So I'd like to say thank you for joining us today for our Cool Sculpting virtual event. And I'm going to start by introducing Maria Brennan-Thorns.
Hello, everyone.
Maria is Qutis's clinic owner and clinical director. And she will talk about the science of cool sculpting, the safety features, and why she chose cool sculpting later on in the presentation. My name's Angela Hunt. I'm a registered nurse, as is Maria. I should have said that. And I lead our cool sculpting treatments, and I'm the nurse business manager for Qutis Clinics. So I treat across all 3 clinics. All right, so we're talking solely about cool sculpting today. This presentation, I hope, shouldn't take any more than 35 minutes. So I'll try and keep things succinct and to the point. And as we go through the presentation, there'll be an opportunity at the end of the presentation for you to ask questions. We'll answer those questions, and then we'll send an email out with everyone inviting you to have a virtual consultation or face-to-face consultation.
It's the lady.
Okay. And if any of you are not on mute, could you just mute yourself, please? Just bear with me one moment. I just want to make sure that everybody who's joining me is on mute. Okay, great. So what is cool sculpting? So cool sculpting is a way to permanently remove unwanted fat through freezing. All right. The sort of what makes cool sculpting is it's non-surgical. So we don't use needles. There's no surgery, no downtime required. And it's the only alternative to liposuction. So it's a way to permanently remove your unwanted fat without having any surgery. That's basically cool sculpting in a nutshell. The areas of cool sculpting that we can treat. So because it's removing unwanted pockets of fat, unfortunately, I can't wrap you in a blanket and get rid of all your fat all over your body. I'm contouring the body. So I can only, under licensing regulations, treat certain pockets of fat on the body. Starting from the head, working my way down, it is the submental area, what commonly is known as the chin area. So I don't remove fat from the facial area at all. We don't want to remove that fat, but we do want to remove often this fat under here. I can remove fat in the bra puff area. So, you know, when you're wearing, if you have a wedding coming up or a big event coming up and you're wearing a dress and you get that unwanted pocket of tissue over there, we can permanently remove that. I can remove fat in the upper back and the lower back area. I can do the backs of arms. I can do inner thigh and outer thigh area, tummy area, and we can treat the knee area as well. And the last area, some people know it, some people don't, it's called the banana roll. So it's just underneath the buttocks. And it's typically an area that I treat when I treat the inner thigh at the same time. And it's because we contour the inner thighs to give you a nice gap, a nice leg silhouette. And then looking from the side of the body, if we remove the banana roll, it can give the bottom a really nice subtle lift as well. So those are the areas that I can treat. How does cool sculpting work? So it's fantastic. So like I said, I'm treating stubborn pockets of fat. So as you can see in this image, this is the first stage. So we start by taking photographs, pre-photographs, and then I mark up my patients. And as you can see in this image, that's exactly how I do it. I have a template that I use. So it depends on the size of the pocket of tissue that I'm looking to remove as to which template I use. And I then mark you. And I use applicators. There's various applicators depending on the size of the area that I'm treating, but applicators such as this one that we place on the body and then we remove that pocket of fat. And the depth of the applicators varies depending on the size of the pocket of tissue. All right? So how does the actual procedure work in relation to your fat cells? So this is really important now that I identify that I'm only removing subcutaneous fat cells. I'm not removing visceral fat. Visceral fat is the fat that you get inside your organs. So below the muscle, below the skin, below the nerves, inside the muscle, around your organs. We all have it. It's a dangerous fat, but you can only remove it through diet, through lifestyle changes. Subcutaneous fat is the fat that we have just under our skin, on top of our muscle, basically insulates our bodies. Again, we all have it, but we have varying degrees of it. And something really fascinating about subcutaneous fat is you develop all of your fat cells in your early developmental years. So from being born to turning 18 years old is when you develop all of your fat cells. After the age of 18, you don't make any more new subcutaneous fat cells. What happens is they either expand or shrink through diet and exercise. And the reason I say that is because it gives me an opportunity to identify how important it is in our early years, so childhood years, of healthy lifestyle and dieting, because a child who is obese in their younger years will have more fat cells throughout their entire lifespan than a child who is healthy, who is of normal weight. So consequently, if you've ever had a friend or you yourself were overweight when you were younger, and now you know that saying, if I look at a piece of cake, I put on weight. Well, it's quite literally true for children that we're overweight, and it's because they're carrying more fat cells. My whole point is the only way to remove the fat cells in your adult years is either liposuction, which is invasive surgery with at least 12 weeks of recovery time, or Coolsculpting. How it works. So again, I'm treating a stubborn pocket of tissue. So this is the fat cells in the area pre-treatment. This is the fat cells during treatment. And what I'm doing is I'm freezing the fat to minus 11 degrees for, on average, 35 minutes. The time duration depends on the area of the body I'm treating, but it's about an average of 35 minutes for an average of minus 11 degrees. Maria is going to talk about the safety features and protection of this tissue and everything else. So I'm just going to talk about what I'm doing to the fat. And I'm aiming to freeze 27% of the fat cells in that target area. Then at the end of the treatment, we do a massage and we encourage circulation and blood back to the fat cells, which encourages apoptosis. So cellular death, and the cells burst, and then they're naturally taken away through your lymphatic system. And it's so beginning of treatment, end of treatment. I've got another image that helps here. So what happens to your fat cells after treatment? Now, it takes 12 weeks to see final treatment results. You start to see results after 4 weeks. Again, this is really important because it's a slow process. And in that slow process means it's very safe for your internal organs. So you don't have, there's been thousands of clinical studies on varying, bear with me. Excuse me, there's been loads of clinical studies on varying body parts in terms of the impact of a large removal of fat cells through, let's say, kidneys, liver, spleen. It has, because it's such a slow process, because we're just killing a small amount of fat cells, target area. Just ask anybody who's recently joined to just mute themselves, if you could, please. It should be at the bottom left-hand corner of your screen. Thanks. Sorry, I lost my flow for a sec. So I'm killing fat cells. The fat cells are then removed from your body through the lymphatic system. So it's a really slow process, has no negative impacts on any other body part. So kidney, liver, urinary tract, nothing. You don't notice it in any of your movements. So any of your natural bodily flow procedures. I can't think of a better way to say that, yeah, Maria.
Excretory.
Thank you.
Yeah.
You don't notice it, basically. And this would be the result. So, and we can treat multiple areas in one treatment session. So this is pre and this is post to give you an idea of fat cell reduction, right? This is the Coolsculpting difference now. So this is when I'm going to introduce Maria to talk. And this is basically around why we've chosen Coolsculpting over any other technology and what sets Coolsculpting apart from any other technology.
Thank you, Angela. So, for all of you who joined a little bit after 1 o'clock, Angela did say earlier that she would it's being recorded, this, and it will be saved and it will be sent to you so that you can view again or view in its entirety after we finish presenting. So, I am the owner of Qutis Clinics, and we have been in business, in practice for 25 years. And the longevity of our practice has largely been to do with the fact that we're skilled and that we embrace new technology, but we are safe. So in a nurse-led practice, we want to make sure that whatever we use has an evidence-based science behind what we're going to do, because we have learned through our time that within a medical practice or a nurse-led practice, our patients, and we still call clients patients, our patients would not be happy with something that was a 50-50 chance of working. It really has to be a very trusted technology source. Now, Angela's just going to, is there any more to admit there? No. So a trusted technology source. So Coolsculpting has been available now for about 11 years, and the technology came out of the US. And just as a little bit of a reminder about US restricted practice, and including how legislated they are, there is something called the American Food and Drug Administration, the FDA. And nothing can be sold that is medical in the US without having this FDA approval. Now, here in Europe, rest of the world, in fact, we don't have FDA approval. We might have manufacturing marks, trading marks, but not something that strictly scrutinizes not only the safety of the individual piece of technology, but also the efficacy, how well it works. So 11 years ago, I was very aware of this product, but I sat and waited a little bit until there are millions of published scientific studies on how safe this is, this technology, before we decided to venture into this and invest in technology for our very valued and treasured clients, patients. I particularly liked on this piece of equipment, Coolsculpting, and that's a registered trademark. I particularly liked the internal safety features of thermal event warnings. So it can never get too cold, or in fact, not cold enough. So not cold enough would mean it wasn't working properly, not delivering a good, efficacious treatment, a treatment that would have results, and too cold could deliver something that you didn't want either, so some disruption to the skin. So unlike unregistered technology and Me Too copies technology, it's the original technology, it's out of the States where everything has to be tickety-boo, and this is what I felt would allow me and my practitioner and nursing team to sleep at night. Does that about cover it?
I think it does, really. If there's any other questions in regards to safety, of course, but questions, just keep them aside, and then at the end you can ping them through and we'll read them out and answer them as we go through. Thank you, Marie. So, personalized Coolsculpting treatment. Now, I have a video I'll show you in a moment, which is a patient. It was a paying patient, and it's there has been no bribery, but it's a patient testimonial, and it's just nice for you all. I mean, I'm talking at you and we're telling you about the treatment, but it's nice for you to hear a patient's experience. But the personalized Coolsculpting treatments that we offer. So I offer consultations. I've been offering these virtually, and I do them face-to-face as well. Virtually typically works, although recently I had one virtual consultation where I had technological difficulties, which was really difficult because it was hard to really sort of learn about my patient and understand their goals and answer their questions. So virtually, but typically virtually does work. If we have a virtual consultation, You just need to make sure you're somewhere private, because I need to see the area of your body that you're interested in having treated. So don't be in an office building, for example. Likewise, face-to-face consultations. I offer these at all 3 of the clinics. And what happens during the consultation is we go through your medical history. I want to hear about your journey and what's brought you to investigate Coolsculpting and indeed have a consultation with me. And then I'll put together a personalized treatment plan, explain to you what I can do for you. If you're suitable for treatment, give you prices, and then we can take things from there. All right. Going forward now, I'd like to introduce my patient. So this is a link to a video, so I'm just giving me 2 minutes whilst I start it. The video is only about 2.5 minutes long, and this is just our patient telling you her experience from start to finish of Coolsculpting. And if anybody isn't on mute, if you could just mute yourself, which is down in the bottom corner, that would be much appreciated. Thank you.
I felt that even with diet and exercise, there were certain areas that just weren't shifting and became a sort of bit of a bête noire on my back. So I felt that Coolsculpting would be a good treatment. I think I liked the lack of downtime. I chose a reputable clinic, and I like the fact that it's painless. Absolutely fine. Everything was covered, very thorough consultation. I learned a lot that I didn't know before. All my questions were answered. I was completely happy. I was very, very well cared for. Everything was explained in great detail. Everything was explained prior to whatever was going to happen. I knew exactly what was going to happen during the day. So it was great. It was very thorough indeed. It wasn't painful at all. It was just a little bit cold, obviously, because of putting the gel on and the applicator heads. It just felt like a little bit of a suction cup. There was no pain. There was really no discomfort at all. Yes, absolutely. Because Qutis has a reputation, it's a nurse-led clinic, and the therapists are very experienced and, you know, under the umbrella of a medical aesthetic clinic. There really wasn't any recovery time. I felt a little bit numb in the area afterwards, and I was warned about that. And that did go on for a number of weeks. I can't say it was uncomfortable or I was inconvenienced by it. So there wasn't a recovery time. It was perhaps a little bit sore that evening, but yeah, mild discomfort. No, I suppose my only question was there a risk of a tissue damage with freezing it? And that was dispelled to me very quickly, so no concerns at all. I feel that it's given me increased confidence because I always felt that I had this bulge on the top of my bra. I had to have quite a broad bra because I'm big busted, and I've always felt uncomfortable. I hadn't wanted anyone to touch me on my back. I've always been a bit self-conscious. So that's really flattened it out nicely, and I'm expecting to see results ongoing. Yes, I would absolutely recommend Qutis.
I'm glad she said yes, that she'd recommend us at the end of that video. Okay, so now I'm going to lead us to some before and after photographs. So bear with me one moment whilst I go down my slide deck. This is what everybody really wants to see, is before and afters. I'll talk you through these photos. I have a large library of before and afters. They're our before and afters as well. So they're not from other clinics. The ones I'm showing here, I find are the most popular in terms of areas for treating. I'll just move this over a bit. So this is an area we call flanks. So it's this area here. This patient is in her 40s, and this was a stubborn area. So this is a patient who was fit, is fit, active, just could never shift this area here. This is 12 weeks post-treatment. She had one treatment each side. And this is a really good opportunity for me to say as well, this isn't a course of treatment. It's not something you need to keep coming back to have. That being said, it depends how much tissue you have as to how many treatments you need. So sometimes patients will have one treatment session and we're done. Sometimes patients will have two treatment sessions. Two treatment sessions are typically spaced 6 to 8 weeks apart. Sometimes, if it's for under the chin, for example, I leave a full 12 weeks because I want to see the results before we treat further, because we wouldn't want to over-treat. I couldn't really over-treat because I could only remove fat cells, subcutaneous fat cells, but I suppose I wouldn't want to waste a patient's money if they didn't have any fat cells left and I then treated them again. Okay, so that's 12 weeks before and after for flank area. Again, when would you see the results? So you'd see the results, 27% of fat cells, you're looking for a reduction in the target area. You begin to see results. We say 4 weeks post-treatment, but my experience that I hear from patients is they begin to see results typically 6 to 8 weeks post-treatment, but everyone really is different. So some patients are hyper responders. Typically my hyper responders, I probably say I have about 68% of my patients are hyper responders, and they report seeing results after 5 to 6 weeks. Otherwise, the rest of my patient cohort, it's 8 to 12 weeks, and final results are seen at 12 weeks. However, internationally, over 70% of patients report seeing continued results up to 6 months post-treatment. And the beauty of Coolsculpting is where I'm permanently removing stubborn pockets of fat. If you put on weight, and this is a really common question, what happens if I put on weight? If you put on weight, you put on weight evenly everywhere where you usually would, but you'll notice you maintain your results in the treatment area, and you have to put on a significant amount of weight to lose those results. You're not losing the results, you're just expanding the remaining fat cells in that area. But when I say a significant amount of weight, I'm talking kind of 5 to 6 kilos plus. And even then, my patients still see, so I treated a patient in her abdomen, and she'd put on 4 kilos between having her abdomen treated and then seeing me, and it's been lockdown. We've all done it. And I saw her at her 12 weeks, and we weighed her, and it's purely to see if her weight is maintained. We weighed her and she'd put on 4.5 kilos. However, visually, she still had the results in her abdomen.
Yeah, and I can say that that's been the same for me as well.
Yeah. And that's my patient feedback experience. So that's seeing results, more before and afters. This patient is in her mid-50s. This is 8 weeks after her first treatment session.
The right one.
Yes, the right side. This is 8 weeks post-treatment. The left, I suppose it's
Left side's before, the right side.
Yeah, the right side's after. The right side, this is after her 2-week all-inclusive holiday where she was convinced she'd put on weight. She went on, and we'd planned a 2 treatment session journey for her, and she had her second treatment session. However, that was 8 weeks post the first treatment session, and that was after a 2-week holiday. She was really pleased with the results. Under the chin, so submental. And it was this area for this patient. So this is an area that, how do you know if you're suitable to have this area treated? I ask a few qualifying questions. One of them is, have you always had it? Does it change with diet and exercise? If you notice that your facial fat, if you lose weight, you see a difference here. If you gain weight, you see a difference here. That's definitely fat. But otherwise, I treat a handful of younger patients, and sort of mid to late 20s, for like lower face fat, and they're really slim, but they just have this.
Genetic, isn't it?
It's genetic,
Yeah.
and they've
jaw
always
shape.
had it.
Yeah.
And we've had some really beautiful results with just contouring their lower chin area. And that's a treatment that typically takes 3 hours, and it's typically one treatment. Inner thighs. So this patient, this is 12 weeks post-treatment. This patient has had a treatment each side of the inner thigh. This is pre and this is post. And again, this patient is in their late 30s. Fit, healthy patient, just always struggled with this gap here, and they just wanted a gap. And she was really, really pleased with those results. This is a good example of a patient. I saw someone the other week, and they were worried about being too big for Coolsculpting. They said, I think I may have too much fat for Coolsculpting, which is a thing, I will say. If I see somebody and I consult them, sometimes certain patients are more suitable for liposuction. But I think we get a body dysmorphia sometimes, and you think, oh, I need liposuction, and actually a session or 2 sessions of Coolsculpting and it's done. Much less results, less risks, and much more pleasing results. Liposuction can sometimes cause a wave, like a rippling effect, which we correct with Coolsculpting. This patient, and why I bring this up is because this patient was one of these patients that thought, I think I need liposuction, I don't think I'm suitable for Coolsculpting. This is 6 months after she had 2 treatment sessions with me. And this patient is in her mid-60s. So that gives you an idea of, her cellular response. It gets slower the older we get, but you can see her results are still phenomenal. And it was about giving her a contoured waist. She's very long-bodied. And what we did was reduce her tummy and contour, as you can see here, her midriff. So basically we just softened this hip entirely.
Can I say how important I have found that to be?
Yeah.
Because I don't do the treatments, but I sometimes will help Angela and the rest of the team by seeing first consultation and then referring them onwards to our Coolsculpting specialists. Contouring, it really is a skill. I was taught this, but I found it out just by, we sometimes see people who've tried inferior technology and certainly gone for a cheap technology. And there is, if they are not treated by a skillful, medically qualified practitioner who knows the direction of the fat pads, etc., they just won't get a good result. So it really is about you as well as the machine.
Thank you. And it is experience. It's making sure that you're looking at the fat pads and treating in a pleasing effect, because it's not just picking up a pocket of fat, it's about silhouette. And, I don't want any rippling on any of my patients.
And understanding like the architecture, that fat underneath, how it would hang if that bit was more concentrated, and not making a mistake on taking something that would make it look an unusual shape or not the pleasing shape, for instance, of a woman, or a different shaping in a man.
Yeah, and that's a really good point, actually. Shaping a waist is completely different in a male frame than it is in a female frame, because we want an hourglass. Typically, some patients want nothing, but traditionally women want an hourglass and men want a V. This patient here, she's in her late 40s, and this was a post-baby belly that she could never shift. And this was 8 weeks post-treatment, and we just treated her tummy, and it was to just reduce her stubborn post-baby belly. Again, really pleasing results. This patient is in her late 20s, and this was outer thigh, and she is about 8 stones. She's
so never considered overweight or fat.
No, not at all.
But just the stubborn area.
She could never. It's her genetic makeup. She just has saddlebags, and this was 8 weeks. 8 weeks post treatment. She had another treatment session after this, but 8 weeks post treatment already, and the reduction was really, really pleasing. She'd noticed it in her gym tights and everything. This is another patient at 12 weeks, pre and post outer thigh. And this patient's gone on, and we're now doing her inner thigh. This is the backs of arms. again, a really stubborn area, and diet and exercise makes it really difficult to shift this fat. So right here was this area of
Message you already. Yeah. Oh God.
pre and post. I just gonna see if I can make sure if I can mute.
So we can hear you if you're not muted.
Yeah, I think I've got everyone
Yeah.
muted now. There we go. So that was pre and that was post. And again, pre and post. Sorry about the muting, by the way. It's usually something that automatically happens when you join. I'm not sure why it hasn't happened this time. Another backs of arms. Again, this both images, by the way, are 12 weeks pre and post, and one treatment session for each patient on the back of each arm. All right, both really pleased. Lower abdomen. So again, this is the same patient actually with the outer thighs that we showed you earlier. And this was her tummy. She's had 2 babies, young girl, 2 babies. And although she's really slight, small woman, just couldn't shift it. And so all we did was tighten and flatten the abdomen with Coolsculpting, 12 weeks post. Really, really pleased. Male chest. This is an area that I'm seeing more and more for patients to treat. And it's this stubborn area right here. This patient is in his, do you remember how old this patient? 50s. This patient is in his mid-50s. And this was 12 weeks post-treatment. And another submental, and this was a really pleasing result. So this was a patient who struggled, really disciplined in her lifestyle now, but struggled with weight in her younger years. So consequently, more fat cells, and just could never, no matter how thin she got, she couldn't shift this under chin submental area. And in treating it, it actually elongated her entire face and defined her jawline.
I think, I'm not quite sure if this is the same one, Angela, and forgive me for interrupting, but we do non-surgical facelifts. We lift the face using dermal fillers and radio frequency. And we sometimes see people who have got a very slight or backward facing chin. Now, this isn't quite this person, but it's just how much having under chin fat removed can help the patient look normalized, balanced. And sometimes I'll be doing injection facelifting, and Angela does that as well, but I don't do Coolsculpting. So I then refer sometimes my patients that have got, forgive the terminology, but a weak chin, and I will have strengthened the outline with a little bit of protrusion of fillers, and Angela will completely finish that facelift off very nicely. Well, there's someone else coming in. We can welcome in. Hello and welcome.
Hello. And yeah, exactly that. So we can really contour and define the facial area with a combination of both injectables and Coolsculpting. Another angle for the submental for you to really look at. This is obviously pre, and this is post treatment on both. She was so, it really had a huge impact.
From a self-esteem point of view, what's she like?
Well, it's fascinating, actually. I was talking about this with a patient that I was treating the other day, and it's the psychological impact of confidence, body confidence, and just contouring and reducing that stubborn pocket. It has such a positive impact on somebody's well-being, and it also is really encouraging. So many of my patients, I'd say over 90%, report back to me that it gives them that little bit of encouragement to stay on the track of a diet or a lifestyle choice that they keep trying to get onto, because one, they've invested in themselves and done something for them, but two, they've already shrunk the stubborn pockets of fat that they just couldn't shift before. So now if they do a bit of exercise or they do a little bit of healthy eating, they see results so much quicker on everywhere else, because they're carrying less fat cells.
It helps their health then, because it's telling them that they can continue, and this time they'll see results. The other thing I think is worth mentioning is clothing choices that you did not let yourself choose. I'll let you go on, but
well, that's so I mean, I can talk about myself personally with that one. I had my inner thighs treated, and I used to hate wearing tight, skinny trousers because I just felt my thighs were, I was really self-conscious of them. And now having that gap, it just gives me that extra bit of confidence. And
with me, it was tucking in blouses.
was it?
So I went
Waistline.
from those awful
Yeah.
baggy things to tucking something in,
Yeah.
because there's nothing to muffin top out of.
Yeah.
Yeah.
And patients really say that. And this is a good point. I should mention this now. You don't have to change your lifestyle at all to see cool sculpting results. So I don't ask you to drink 10 liters of water every hour for 3 weeks, nothing like that. You just, all that I do ask is you maintain your existing weight. So I don't want you to have Coolsculpting go away and put on 10 kilos, but likewise, you don't need to do anything else. You just need to carry on taking care of yourself as you were pre-treatment, and you will see results. Okay, so this is my question time. Thank you so much for your patience. Again, I apologize about the muting. I've got a list of questions now, so I'm just going to turn off my screen share, and I will read out my list of questions. So I will go, and then Maria, we will just take them in turns. And so first question, and thank you. How many treatments can you have in a day? So it's more, I think it's probably a great question. Thank you. It's one I get a lot. It depends what I'm treating. So it's more about the area that I would treat as opposed to how many treatments you can have. Because I look at an area like, let's say, an abdomen, that's a treatment. So an abdomen, depending on my patient and the amount of fat that I'm treating in that day, depends on how long you're with me. But just this week, I've treated an abdomen and flanks. We did it all in one day. I like to treat, if I'm starting an area, I treat it to completion within the same day, because I don't want to treat half an area and then have to remember where I've treated 2 weeks later. That does mean that if we're doing, for example, abdomen, so tummy and back area, you're going to be with me all day. So that can be anywhere from 5.5 to 7.5 hours. If I'm treating under here, like I said, it's 3 hours on average. If I'm treating arms, it's about the same, 2 to 3 hours on average. Outer thighs can be about 4 hours. Inner and outer thighs, again, can be a whole day. So it really depends. It's something we would discuss during the treatment consultation. Another question is, how cold is it? It's interesting. It's more numb, actually. So within the first 2 minutes of the treatment, you feel, so it's a suction, depending on the area that I'm treating, but it sucks up the tissue, and it feels, freezing can either feel really hot, like burning, or it feels freezing. It feels that weird pins and needles freezing for about 2 to 3 minutes, and then you go numb and you forget about it. But it's a difficult thing to try and explain to somebody, because as you heard from my patient earlier in the video, she said it was comfortable and she was fine. Whereas another patient can say to me, oh, Ange, I didn't realize how sore that was going to be. It's so subjective. However, I mean, on the odd occasion, I give my patients some paracetamol to help them feel more comfortable, but other than that, it's relatively
I would say I was very comfortable.
Yeah.
And I know that they didn't sculpt my feet, but I have very cold feet.
Yeah.
So I bought my best cashmere socks in
Well done.
for my time.
Yeah.
And a good iPad and
I think that's
earphones.
it. We make a point to try and make you as comfortable as possible, because you're with me for the whole day, and it's basically like being on a long haul flight. You're kind of stuck in a bed. You can get up and go to the toilet, but you have to come back and you're stuck in this bed. So bring something good to read or watch, and something warm for your feet. And otherwise, I'll wrap you in blankets and shower you with hot gifts. Yeah.
Hot gifts.
Shower
hot gifts.
Hot drinks. And other gifts. But yeah, lots of people work.
Yeah.
Or sleep. I have a lot of mums that come and just have a day off, and they say it's like a day at the spa, and they just sleep through the whole thing. So we try and make it comfortable. Is it just one treatment or is it multiple treatments? Thank you. It's a good question. And again, it's typically one treatment, maybe two treatments, depending on how much fat I'm treating in the area. It's not a course. Each treatment you see results. Each treatment results are permanent. Okay.
Yeah, I mean, I would just say that if you like the results on the front of you, you sometimes decide to have the back of you done.
Yes.
You didn't come in with that original request.
Yeah, I think
certainly it was with me.
That's my caveat. It's addictive.
Yeah.
I have a good question here. So if this is a post mummy baby belly, and she's got loose skin, and she's asking if the skin would be even looser after treatment. So sometimes yes, sometimes no. Typically, the answer is it's more about the impact. So if you take away fat, you'll have sort of loose skin, but it depends on age as well. It's a hard one to answer. I think it's better to show you in visual pictures. In my experience, every tummy, so it's typically seen with tummies and with arms. I won't treat arms of a certain age if I'm worried about skin laxity, that I think I'm going to take away the fat and then my patient's just going to be left with loose skin. That's very rare that I have to make that decision. With tummies, 99% of the time we can remove the tummy fat, so we remove the bulk of the stubborn fat in the area. You are left still with your stretch marks and your loose skin, but because I've removed the fat, it kind of tones the tummy area. So I can't answer it directly because I can't say, yes, it's going to make the skin looser. You're not going to be left with a bib, but I'd have to actually see you to be able to give you a bit more of a definitive answer. But we can, if your lifestyle doesn't allow you to come in and see me, we can do that virtually. Does it work well on men? Yes, amazingly well on men. The thing with men is not a lot of them want to share their photos. So yes. I can show them when I do a face-to-face consultation, I can share photographs then because I'm not showing them on a public platform. But right now I can only show a certain amount of photos that I've had consent to share. Can you exercise after treatment? Yes, you can exercise. Thanks for reading these out. You can carry on as normal straight after treatment. What happens, so right after the day of treatment, I ask my patients, and this is my preference, I ask my patients to not have a really cold or a really hot shower or bath that day. And it's because I've put your tissue under extreme temperature. I don't want it under any other extreme temperature that day. And it's more about your comfort. Otherwise, I ask you to avoid, unless you have a medical condition that requires you to take them, I ask you to avoid anti-inflammatory medications. So that's things like ibuprofen, Nurofen, antihistamines, aspirin. And it's because I want the inflammation post-treatment. However, if you have a medical condition, such as a heart condition where you have to take aspirin, that takes precedence, and it wouldn't significantly impact your treatment results. Do I need to tell you anything specifically in my consultation? Well, all I would want to know, so I want to know about your age, I want to know about your height and weight. I'd like to know about your medical history, so any medications you're taking, any medical conditions you have. There's very few medical conditions that are contraindicated for Coolsculpting. Thanks, Maria. I feel like I've been talking a lot. Contraindicated for Coolsculpting. One of them, it's anything like blood cell responses that have a specific response to cold temperatures. It's very, very rare, but that is directly contraindicated to treatment. Otherwise, for example, diabetes isn't a contraindication, type 1 or type 2. I just treat with caution, and I would want to have a discussion about it. Tell us everything in your consultation, please. Yeah. So this is a question, what is the science that makes the freezing process only target and kill the fat cells and not other cells in that area? Is it that the fat cells are particularly susceptible to that level of cold? So yes, I suppose is the short term. So first of all, the science is based on, so I'm taking that pocket of fat, I can only freeze fat cells. So if you didn't have fat cells in the target area and I sucked it up, all I would do is put you under discomfort
Cold discomfort.
Cold discomfort for no reason. But the science, to sort of speak in layman's terms, it's quite literally that. It just targets the fat cells. And it's because fat cells in particular within the subcutaneous area, remember, we're just talking about this area of the body, the outer region of the body. Fat cells are sensitive to cold. It was first seen and discovered in the 80s in Mexico by a pediatrician, ironically. He noticed a pocking in cheeks of children that from sucking on ice lollies. And so it was first documented then. And then 10 years later in Canada, it was next documented by a group of physicians who noticed a recurrence of female equestrian riders. And it was female in particular because we carry more fat in our thighs. But from riding in the colds of Canada outdoors, they had this pocking, again, indentation in their outer thighs. And it was theorized that it was because of the extreme cold temperature. And therefore, the investigation was done, and it was with Michigan and Harvard University that they undertook research.
Is the cost figured out per treatment or, say, per panel used? So if you have the abdomen done, say it is not that one treatment price, or because it may need several panels, the price for the abdomen would be very dependent and would vary depending on how many panels needed. Is this true?
So sort of. The price, I like to price per area. And it's because we talk about price per panels, some clinics do, but I'm more about getting results. So if I can aim to if we're looking to reduce an abdominal area, I'm not going to price you per panel because that makes my patients think, well, if I had half those panels, I could spend half that price. But then the result is you're still going to spend money and you're going to have a subpar treatment result. So I price per treatment area. Everyone who's joining me today, we will automatically qualifies for a discount that we will discuss during virtual consultations. But to answer your question, I like to price per area, but I would go into more detail with you during one-to-one consultation.
Which of the Qutis clinics has Coolsculpting? Yeah,
so thank you. Good question. I'm in my Hemel clinic, which I'm at today, and in my Tame clinic. So we're available to Coolsculpt in Tame Tuesdays and Wednesdays, and in Hemel Thursdays, Fridays, and Saturdays.
Well, that's nice. You've got a thank you there.
That's nice.
I don't know.
Yeah, I think that's everything.
Do you send the answers to the questions directly to these people afterwards?
I don't, but this has been recorded.
It has.
Yeah. So I just want to thank you all again for your patience with today's presentation. Sometimes Zoom and these things can be a bit clunky. Again, I apologize for the mute, that it wasn't automated when you joined. Really appreciate you joining me today. I will send out an email to you all with a copy of this video so you can scan through it and listen to me babble on, and an invitation to book a no charge consultation with me. We can do that either virtually or face-to-face. I'm going to say in advance that I'm very busy going into April because we're doing a full grand reopening from Monday, the 12th of April across all 3 of my clinics.
Are you booked up?
I'm booked up. I'm quite busy. However, that doesn't mean I can't fit you in on different time slots across, in the next couple of weeks going forward. So I'll email you all an invitation and then we can get in touch through there. Thank you very much.
Do you want to admit this last person and tell her that it will be put on?
Yeah. Just saying hello, and this is the end of the presentation. I'll send a recording of today's presentation through email to you all. And again, thank you so much for joining. I really, really appreciate your time. Thank you. Bye.